So good afternoon, one and all. Sir, good afternoon, Natras sir.
Good afternoon, Dr. Sunil.
Good afternoon, Sunil sir.
Okay.
Good afternoon, Anand sir. Sir, Natras sir.
Okay, thank you. Thank you. Yeah, respected today's speaker, Professor Monica Madam, and my fellow teachers, and my dear students, my warm welcome to one week online FDP program entitled Emerging Technologies in the Field of Healthcare and Pharmaceuticals on 28 December 2023. On behalf of students, staff, and management of Sri Vishnu College of Pharmacy, Bhimavaram. The main objective of the FDP is to bring awareness on present technologies in healthcare and pharmaceutical care. My sincere thanks to all speakers for acceptance of our invitation, in spite of their busy schedule. I wish you all the best to the faculty and students. Make use of all the sessions, and we can find many more takeaway points. Okay. So, and most important, today's speaker, Professor Monica Madam, is working from 2 decades in the same institute, lovely professional university, being as a registrar is present. Okay. So I am very thankful to the madam, in spite of most busy schedule, she agreed as a speaker. Okay. I'm thankful. With this note, I welcome you, madam, and all the best. Over to Sunil, sir. Thank you.
Thank you, Natras sir. Sir, I would like to invite Dr. Anand for introducing the today's speaker. Anand sir.
Thank you, Sunil sir. So, I am Anand Addagala, Associate Professor. So, I took a privilege and honor to introduce today's speaker, Dr. Monica Gulati Madam. She is a Registrar and Executive Dean at School of Pharmaceutical Sciences, Lovely Professional University, Punjab, India. So, Madam has an experience of 30 years in different fields like teaching, research, and administrative experience. Her major interest and in research area is enhancing the bioperformance of drug molecules introducing small and large biomolecules, phytochemicals, probiotics, metabiotics using conventional and novel dosage forms, especially in the area of colon targeting. She holds a keen interest in quality control parameters of delivery systems. Her group has designed novel platform technologies to overcome the challenges in therapeutic delivery of different class of phytopolypeptides and phytochemicals. So Madam has more than 250 high impact factor publications and having 4,300 citations, one book and 12 book chapters to her credit. Madam has H index 37. She has been granted 6 Indian patents and 22 have been filed and published. She is one of the editorial and review board of more than 20 journals. She is on the advisory board of 4 pharma organizations as an honorary member. So I'm very thankful for giving this opportunity. Thank you, madam, for accepting our invitation. I welcome you on behalf of our college. Thank you. Sir, it's over to you, Sunil sir.
Thank you, Anand sir. Thank you for a very exciting and introduction of the madam. So now I'm handing over the session to Monica madam. Over to you.
Thank you. Thank you, Dr. Anand, for such a wonderful introduction. And I would also like to express my thanks to Dr. Nataraj and Dr. Sunil. You know, at the last moment, I had to make some changes in the schedule, and they were generous enough. They were kind enough to allow me that change. So now I'll, Dr. Sunil and Dr. Nataraj, so should I start the presentation?
Yes, madam.
Right. Thank you. Please give me a moment. So, dear friends, we have been, all the students and all the faculty members, we have been taught about the effect of drugs on the health. Right from the beginning, the day we enter the pharmacy profession. But apart from that, now everybody knows that nutrition is also a very important kind of point. I hope my presentation is visible to everyone.
Yes, ma'am.
All right. So there is another very beautiful area that has not been, I would say, neglected for a long time. We all know that there are a lot number of microorganisms in the gut of human beings, of the animals also. So gut microbiota and their non-pharmacological manipulation. When I say non-pharmacological manipulation, I mean that we are not giving any drug for the treatment. So this has come up as one of the latest techniques in fighting many diseases apart from the conventional drugs. So I will just start with the basics. So you see, all of us, we know about Hippocrates. The Hippocrates oath is taken by all the medical professionals when they enter their profession. So, before, in BC also, before Christ also, he was able to pinpoint that intestine is the paradise of disease. So he says that death sits in the bowels. A bad digestion is the root of all evil. Now, this has been confirmed by the scientists of the current scientific age, and a number of therapies have also come. Therapies which are basically not based on drugs. So let us take the things one by one. So as you can see, the term dysbiosis, biosis is the basically the microenvironment of the gut. So the microbiota which are there in the gut, they have a very beautiful equilibrium with the rest of the system of the body. But when this equilibrium gets disturbed, we call the condition as dysbiosis. When it is normal, we call it eubiosis. So dysbiosis is when the equilibrium between the microorganisms inside the gut with the rest of the body system gets disturbed. And the factors that disturb this system or microbial system will include, tobacco smoking. So cigarette smokers generally have a dysbiosed gut microbiota. Alcohol intake, of course, the constant alcohol intake, too much consumption of red meat, constant stress. We all undergo constant stress. So that is the reason, our parents or our grandparents used to be healthier than us. Long use or repetitive use of antibiotics, because antibiotics are killing the pathogens, but along the way they are also somewhere killing the good bacteria of the gut. Obesity is a lifestyle disorder. Radiation, the people who are exposed to radiation either because of some medical conditions or because of their profession, like radiologists or radiographers. Then with age also, after the age of 60, it is said, in fact, after the age of 45, it starts appearing, the microbiota starts getting changed. But after the age of 60, it is documented that dysbiosis sets in. So you have to tell your parents or your grandparents to take certain measures so that the dysbiosis does not actually occur. Then, of course, the worms. If the worms are there in the gut, obviously they are going to change the gut microbiota, and constant inflammation in any part of the body, especially in the gut. If somebody has stomatitis or colitis or something, so inflammation of the gut generally leads to a disturbance in the equilibrium of the microbiota in the gut. So when equilibrium gets disturbed, what happens? The pathogenic bacteria, they start flourishing. So there is an abundance of bad bacteria. The good bacteria, they start depleting. So there is a decrease in the number of the good bacteria. And there are a few, there would be a ratio of the bacteria. So if there is already a particular bacterial species which is a little less in number, it may get extinct completely. It may get obsolete. So that its presence stops being there in the gut. And then, the diversity gets decreased. All of you must have heard of diversity. We keep on talking about the country diversity. So here we are talking about the diversity of the microorganisms which are present in the gut. And when there is dysbiosis, so as you can see my previous slides, this indicates the reasons for the dysbiosis. This indicates the intestinal pathologies or the diseases of the intestine that arise due to dysbiosis. So one was the cause. This slide was telling you the cause. This slide is telling you the effect. So recurrent Clostridium difficile infection is one of the major conditions which occurs due to dysbiosis. Then ulcerative colitis, Crohn's disease, which eventually leads to colon cancer, irritable bowel syndrome. Many of us, and for irritable bowel syndrome, the basic cause is considered to be stress. So stress leads to dysbiosis, and then dysbiosis leads to IBS. It leads to diarrhea as well as constipation. So in certain patients, it will manifest as constipation. In certain patients, it will manifest as diarrhea, depending upon which are the pathogenic bacteria which are actually striving. Then we have colorectal cancer also. I hope, am I audible?
Yes, madam.
Okay. So colorectal cancer is one of the last stages of dysbiosis. Then we talk of, generally we feel that if there is a dysbiosis in the gut, it would probably lead to only the diseases which are related to intestine. But sadly, this is not true. There are many other diseases. Especially, you see, they say that there is a gut-brain connection, there is a gut hormone connection, there is a gut-lung connection, and so on. So practically every part of your body is somewhere affected by the microbiota in the gut. So you can see there are certain diseases, of course, which are related to CNS. Parkinsonism is there, Alzheimer is there. A clear-cut relationship has been established between gut dysbiosis and Parkinsonism and Alzheimer. Then PCOS, polycystic ovarian syndrome. So here you can see that it is the hormones which are getting disturbed because of the disturbance in the gut microbiota. I'm sorry, this is repeated. And then we have insomnia. Insomnia, again, somewhere, it is a psychological disease when people are not able to sleep properly. Then we have gout, inflammation of the joints, diabetes, depression, arthritis, obesity, and chronic obstructive pulmonary disease and multiple sclerosis. So you see, just one dysbiosis wherein we have not been able to take care of our gut microbiota leads to so many things, and many of them are actually they will express as lifestyle disorders. So everything is dependent upon each other. Moving on, of course, we all know there are so many faculty members would be teaching you pharmacology, wherein they will be telling you about the drugs which can be used to treat all these diseases. But the latest techniques lead to avoidance of the drug and certain other manipulations in the gut microbiota, so that we are able to rectify the condition as much as possible without the support of the drugs. So first option, which is very popular these days, is probiotics. Many of you might have heard or consumed Yakult also. Otherwise, our own dahi, the yogurt, which is very common, that also contains probiotics. So probiotics are basically the good bacteria which are there in the food, particularly the fermented food. So it contains.
Madam, your sharing stopped.
సార్ మేడం డిస్కనెక్ట్ అయినట్టున్నారు, అందుకే షేర్ లేదు, వాయిస్ కూడా రావట్లేదు.
Madam was disconnected due to network issue. Madam will be joining soon. Madam, Monica, madam.
Yeah. I'm sorry, there was some issue with the connectivity.
No problem, ma'am. You can start sharing, madam.
Yeah, I'll do that. Give me a moment.
Okay.
Give me a moment. There seems to be some issue with it. Is it visible now?
No, madam.
Is my screen visible now?
No, madam.
Not visible, madam.
Now? Is it visible now, sir?
No, madam.
I don't know, there seems to be some issue with it.
Or you can share the PowerPoint, madam.
I'll do that. I'll do that. Now, sorry?
No, madam, not shared.
No, not shared. I'll send a mail to you. Give me a moment.
Yeah.
Give me a moment. I'm attaching it, then we can go ahead. I've sent it. Please check. Sir, can you share your mail ID?
Please share through WhatsApp now.
Give me a moment. Okay, I'll share through WhatsApp. So please check your mail.
Madam, the screen is shared, madam. Can you see it, madam? Monica, madam?
Yes, sir, I can see it. Can we move on?
Okay, madam.
Yeah, so this is where we were. This we had already covered, sir. Please go to the next.
We are at the dysbiosis, madam.
Yeah, this is where we were. So I was sharing with you that when we talk of the gut microbiota equilibrium, the dysbiosis not only causes the intestinal problems, but it also causes so many other issues which are related to CNS, certain neurological diseases, certain respiratory diseases, certain inflammatory conditions. In fact, all the lifestyle diseases are supposed to be somewhere affected by dysbiosis. So next, please. So then we come to the non-pharmacological options. We had already discussed about probiotics. We had discussed about prebiotics. So please, next. Next.
One second, madam.
Sure. Yeah. So here we were. So prebiotics, as I shared with you, are basically carbohydrates which are not digested by the human gut but can be digested by the good bacteria. So when we combine the two, so that we are at the same time administering the good bacteria also as well as food for them, then we call them synbiotics. So it contains both live bacteria as well as their food. Then we talk of another thing which is known as the metabiotics. Now, metabiotics are basically the metabolites of microorganisms or metabolites of probiotics. So, it was found out by the scientists that when probiotics are used, what generally happens is it is their metabolites which are good for the human beings. And since many of us, we have our reservations about administering live bacteria into our bodies, and then quality control was a major issue. How do you check whether the probiotics contain only the good bacteria and there is no contamination by the pathogenic bacteria and so on? So the next step was we started talking about metabiotics, which are the beneficial metabolites of these probiotics. So it was easy for us to ensure that there is no contamination by the pathogenic bacteria. They could be standardized, quality control could be maintained, and so on. Now, then it was found out that just taking one or two species of bacteria, or as you can see, the fungi also, which are good fungi like Saccharomyces boulardii, that kind of strain is not sufficient enough because you see, gut contains thousands of bacteria. So it was found out that you need to have at least 10 plus species of good bacteria and fungi combination to have any kind of clinical effect. So after that, this latest kind of concept started, that is fecal microbiota transplant. So what is generally done in this is the fecal matter is taken from the healthy subjects. It is filtered. It is diluted with the buffer and then filtered, and then that is administered into the patient. The administration can be done through various routes. It was done by colonoscopy, it could be done through enteral route, it could be done through esophagus also. But recently, a very good progress that has been made is that fecal microbiota has been taken, it has been purified, and it has been put into capsules. So the capsules are basically lyophilized capsules, and they contain the lyophilized extract of fecal matter of the donors. So they are now available commercially also. So in this, as I shared with you, the fecal matter from the healthy volunteers is shared with the patients of these diseases that have already been mentioned, and it is done through a very convenient route of oral route by the capsules. So next, please. So could we go to the next slide? Yeah.
Yes, madam.
We have a problem with this thing, ma'am. Just give us a second because it was stuck.
Surely, surely, sir.
Yep.
So as you can see, these are the good bacteria, the green ones. You know, they are helping the patients recover from fever. They are helping the elderly people, and then they are improving the lifestyle diseases also. So next slide, please. Yes. So now let us find out how do they work. So the mechanisms generally which are, I'm sorry for the mistake, there is an extra A in the mechanism spelling. So generally how do the probiotics and the non-pharmacological approaches they act? One thing is, you know, our gut has very limited supply of the dietary ingredients. So if the good bacteria are there, they will compete with the pathogenic bacteria, and then they will eat a part of their food, and they will not allow the pathogenic bacteria to flourish. Then another very good mechanism is that they don't allow the sugars to stay. So what they'll do is they'll ferment the sugars. We all know that good bacteria, you know, and the fungi, they thrive on sugar. So what they'll do is they'll ferment the sugars into smaller fermentation products, so that, you know, the lifestyle diseases like diabetes and obesity and all those things they do. Then they are also responsible for production of growth hormones for various vitamins like vitamin K, vitamin E, vitamin B, almost all components of B complex are synthesized by these good bacteria. Then they produce a metabolite which is known as the bacteriocins. Now, bacteriocins, as we all know, they do not allow the other bacteria to grow. So these bacteriocins, they will kill the pathogenic microorganisms, and these bacteriocins are produced by the good bacteria, that is the probiotics. Then, you know, the bacteria or the fungi, they bind to the surface of the intestine. So the intestinal mucosa has a limited area, and when the good bacteria are there, they will dislodge the pathogenic bacteria, so they will compete with the microorganisms for the binding sites available on the intestinal mucosal membrane. And one of the very important functions of these good bacteria is to improve the barrier function. So once they improve the barrier function, you know, the chances of sepsis, you know, the pathogens or the toxins entering from the gut to the blood, that reduces because the barrier is strengthened. And since they contain small fatty acids, small chain fatty acids, they are responsible for reducing the inflammation. And when we see inflammation, it is inflammation of gut, it is inflammation of brain, it is inflammation of liver, everything, because they lead to the production of small chain fatty acids like butyric acid and propionic acid, which are known for reducing the inflammation. And then because of all this, they increase the immunity of the patients also. We can go to the next one. So this is the pictorial presentation of whatever I talked. You see, they compete for nutrients. They lead to production of small fatty acids. Small chain fatty acids reduce inflammation. They improve the immunity, and they of course improve the barrier function also. We can go to the next slide. So as you can see, they are producing the vitamin D, they are producing vitamin K, they are cleaning the gut, and they are increasing the motility of the gut also. Next. So is my voice okay now? Can you hear me well? So
Madam.
Your voice is not clear.
now is it better?
Yes, madam. Now it is better.
Okay, so these are the uses of probiotics in the gut. So it will fight the intestinal infections, as we talked, the Clostridium difficile infections, which are considered to be the toughest to go. So it will help there. And antibiotic associated diarrhea. We all know that when, we are taking antibiotics, the doctor will tell us to take lactobacilli. Right. So the reason is that these good probiotics, they help in removing the antibiotic associated diarrhea. They help in colorectal cancers and helicobacter infections, also IBS, constipation, and lactose intolerance. So we touched all this. We can go to the next slide. So if we say beyond the gut, earlier conditions are all related to that. So the good probiotics, they can help us in overcoming allergies, because of which I shared with you that it can help us in tackling the chronic respiratory syndromes also, COPD also, chronic pulmonary disease also, and helps in obesity and weight management, osteoporosis, which is otherwise very, very difficult to take care, because it leads to production of growth hormone also, and it leads to conservation of calcium also. Diabetes, Alzheimer, acne is another area where the probiotics can help. Asthma, and even in vaginal infections, wherein we talk of vaginitis and vaginosis, probiotics are very helpful. We can go to the next slide. So the species which are known as probiotics, which are established as probiotics by the clinical trials that have already been completed, these are the species. You can see bifidobacteria and lactobacilli. Apart from that, these species of bifidobacteria and lactobacilli, we have lactococcus also, certain species of Saccharomyces. Now Saccharomyces is a yeast. It is not a bacterial species. Streptococcus also, and Enterococcus. Now you will find in the market there are small drinks like Yakult. There will be certain milk powders, certain yogurts also come. Cheese is there, ice creams are there, which contain these probiotics. So you can take probiotic enriched ice cream. If you Google it out, you will find so many options available. Next, please. So you see, in the year of 2022, almost 523 million US dollars were generated by the probiotic market, right? But some limitations with the probiotics is that there are certain volunteers who will not be able to allow these bacteria or these fungi to thrive in their gut. So what happens, especially if you are taking probiotics which have been imported from abroad, like Yakult is basically from Japan. So the microorganisms which are there in Yakult are the microorganisms which are indigenous to the people of Japan. So they are useful, but only for that time till they are alive. They will not get attached to the gut of the Indian population. So what happens? You take them, they exercise their beneficial effect, but once they are consumed, they will not stay there and they will not reproduce further. So we need to have certain good bacteria, certain good yeast, but at least in a combination of 18 strains, because it is said that 2 or 3 strains will not be very beneficial. So as you can see, the second line says that a combination of 2 or 3 probiotic strains will not help them decolonize. So they will not be able to colonize there. However, they will be effective only till their life is there. So to colonize them in our Indian gut, we need at least 18 strains, out of which should at least 9 should be bifidobacteria and 7 should be lactobacilli. Then apart from that, you can have some Saccharomyces strains or Streptococcus strains also. So we will move to the next one. So this is what I was trying to tell you. They face tough competition, and reproducibility has not been very good, and some of them are being sold as spores. So some of them, when the spores are not able to hatch and become vegetative, then they are practically rendered useless. Next. So as I was sharing with you, you can see the pink dots. So the pink dots in the picture at the top is they are the prebiotics for the food, and the good bacteria are the green ones. So they are not digested in the gut, but they have beneficial effects because they are eaten up by the good bacteria. So since if we are providing good food for only good bacteria, so they turn out to be more selective and help in the improvement of the health of the host. Next, please. So this is a combination. We have probiotics and we have prebiotics, and together, they are going to create synbiotics. We can go to the next one. So this I have already explained. I think I am left only with 5 to 10 minutes. So I think we can skip this slide. I have already explained this. As you can see, when we talk of the examples, we have oligofructosis, inulin, lactose, pectin. Now let me share with the younger generation of when we say pectin and cellulose and apple polysaccharides, they are pectin is basically there in the the threads of the orange which we throw away. Similarly, cellulose would be there in the uh, mostly in the peels of the fruits. So if there is guava, we generally tend to peel it. But the peel is good for us. Similarly, the apple polysaccharides will be abundant in the peel of the apple. So what I try to suggest is that you should try to eat the whole fruits and the whole vegetables. If of course they are edible, because it is basically the fiber content, whether it is pectin or cellulose or other polysaccharides, which will provide the prebiotics, and they will help in flourishing the bacteria, good bacteria, which is already there residing in the guts. Next. So these are the differences. We can consume about 10 grams of non-digestible fermentable fiber. We can go to next, sir. So as I shared with you, when we combine the probiotics with their food, the picture I showed you with the pink colored food and green colored probiotics, when we combine them, we call them symbiotics. Next, please. So symbiotics are mixtures of probiotics and prebiotics that are basically helping the host recover from certain diseases. So what we do is we take the live microbial culture of probiotics and combine them with the certain dietary constituents like fibers and carbohydrates, so that they are able to flourish together. Next, sir. we can go to the next slide. So these are some of the publications done by my group. So you can see there are five publications. I have given the links also. So after this, in fact, there have been 2 more in last year. So these are the preclinical work wherein we have used this for colitis, we have used this for gout also, we have used this for inflammation, and we have also used this for colorectal cancer. In one case, we have used this for diabetes, and then we have progressed further and gone for wound healing also. Diabetic wounds are very common, especially in the food. So these kind of wounds have also responded very, very well to the symbiotics. And currently, we have also started working on certain neurological diseases. We have also found out recently that they are very effective in polycystic ovarian syndrome also. Next, please. So we use PCOS in rats. And as you can see, we have received this, we have been granted this patent on symbiotics. So this is the patent certificate. And one of my students, Ms. Rudia, she talked about the usage of symbiotics in diabetes, and she presented it in front of some Nobel laureates, and her work was very well received and very well lauded by the great scientists in US. Next, please. So then we come to the third thing, which is metabiotics. Metabiotics, as I shared with you, are basically the metabolites of probiotics. Now, the biggest advantage is when you are administering metabiotics, you are not administering any live bacteria. So you just take the culture of the probiotics, filter it out, and all the dissolved substances, they can be used as metabiotics, and they are the best thing about them is we can exercise a very strong quality control on them. Quality control of live bacteria becomes very difficult. So these are measurable and you can analyze them also by HPLC or HPTLC. Next. So when we talk about metabiotics, as I shared with you, they contain short-chain fatty acids like butyric acid, propionic acid. They contain polyunsaturated fatty acids also. We have already talked of bacteriocins, which are basically the materials produced by the bacteria to kill the other bacteria. And then we have smaller polysaccharides also produce amino acids. The small parts of the plasma membrane, that is plasmalogens, is also very effective. They produce vitamins and they produce aptamers. Now, aptamers basically enhance the immunity of the host. So these are the components, 8 components of the metabiotics. Next, please. So when we talk about metabiotics, the mechanism of action is they decrease the colonic pH, they inhibit the growth of pathogens, especially the short-chain fatty acids. They improve the function and integrity of the epithelial cells. This I discussed earlier also. So they are enhancing the immunity, they are enhancing the barrier properties, they are enhancing the antioxidant effect, and then they cause cell lysis of the those cells which refuse to undergo apoptosis. So the cells which refuse to die, that means the cancer cells. So they cause lysis of those cells also. And along with that, they also inhibit metastasis, which is basically performed by the aptamers. So next slide, please. I'll be quick. So we can go to the next slide. This I've already explained. So these are the indications that have been clinically proven to be cured by fecal microbiota transplant. As I shared with you, the fecal matter is filtered and then it is transplanted into the host. So you can see the list is very long. Of course, the success rate has been the highest in case of Clostridium difficile infection. And then IBD also, it is quite good. Diarrhea, irritable bowel syndrome, constipation, obesity. For the rest of them, the clinical trials are still going on, and we do not have the percentages because some of the clinical trials have already reported that it is useful, while some of the clinical trials are still going on. So you can see it is found to be effective in a number of neurological disorders also and respiratory disorders also, and autoimmune disorders. So routes that can be used for giving the fecal microbiota transplants is it can be given through enema, it can be given through colonoscopic and nasoduodenal tubes, nasal jejunum also, capsules are also available as I discussed with you. Otherwise, it can be done through percutaneous endoscopy or secostomy, which is a less invasive kind of route, and then transendoscopy also. But the most popular is either enema or oral capsules because they are relatively easier to administer. You don't need to get hospitalized and so on. Next slide. So which are the factors which basically affect the success rate of FMT? Of course, route of administration is one. Fresh samples give better results. Volume needs to be a little more depending, of course, on the condition for which we are using it. We are doing it singly or are we doing it repetitively? So if the disease does not get resolved, then we can go for multiple FMTs also. Then whether the transplant is of self or it is of a relative or it is of a friend who is not related, or it is of super donors. I will also share with you what super donors mean. Then of course it should be convenient and it should be cost effective also. Please go to the next one. So these are some of the preparations which are available in the market. We can go to the next one. So that's all from my side, and I'm sorry for the technical glitch that happened. I'll be very happy to answer any questions if there are any.
Indeed, the session is a very wonderful session. It is a need of our for understanding our gut properly to take care of the human health.
Yes.
So with this wide usage of this antibiotics, the gut natural microbial flora is actually being destroyed a lot. So one of the participants is asking, so how these aptamers can be utilized for the gut microbiota?
Sorry, sir.
How these aptamers can be used for gut microbiota therapy?
Sir, it will not be used alone. So my answer is it cannot be used alone. You need to have a cocktail of all the metabolites of the bacteria, of the good bacteria. So what is done is generally we grow the bacterial culture of the good bacteria, then we filter it thoroughly. We call it SFF. It is basically sterile fecal filtrate, which contains only the metabolites. No live bacteria is able to pass through that membrane. So, in combination, the metabiotics are quite effective in terms of the gut and the non-gut issues also. I hope I've answered your question.
Yes, madam. Participants, any other questions? You can unmute and you can ask yourself.
So, sir, otherwise you can share my mail also with them. They can ask me any question through mail also, not an issue.
Madam, another question. So currently we are actually looking for the newer and newer type of antibiotics for the treatment purpose. But I think very less studies are being conducted how these new antibiotics are affecting the human gut microbiota. So we are focusing only on killing the bacteria, and people are not concentrating how these new antibiotics are focusing on the gut microbiota. So
Yes, sir.
is there any approach that we can look into this?
So these days, what is happening is many doctors who are aware of the gut microbiota effects, they are generally prescribing in the initial stages of infection. They are generally prescribing probiotics rather than antibiotics, and generally when they prescribe antibiotics, they will always give a combination of antibiotics with probiotics so that the good microbiota, they are not compromised. So this is the approach of the physicians now who are well aware of the effects of gut microbiota on the human health. So any more questions?
Participants, you can ask the questions. Meanwhile, the feedback link is shared in the group.
Yeah, please, you can share my email. Should I write my email ID here?
Yes, madam, you can share it.
Okay, yes. So anyone can send me a mail, and if you have any queries, you can please share them with me. I'll try to answer those queries. I've shared my email ID. So thank you so much. I would not like to, keep the next resource person waiting. So thank you for being such good audience, and thank you, Dr. Sunil, and thank you, Dr. Natraj, for inviting me over.
Madam,
Yes.
thank you for sparing your valuable time in spite of your busy schedule.
Thank you, sir. Thank you so much.
And sharing
And
valuable insights about the human gut microbiota.
it will be a pleasure to, collaborate further also. So if there is any opportunity, I'll be happy to contribute. Thank you so much. I'll take your leave now.
Thank you.
Thank you.
Such a pleasure. Thank you.
Participants, thanks for participating in the event. The feedback link is shared in the group. We'll share in the WhatsApp group, don't worry. Participants?
Yes, sir, you can share it.
We'll share it in the WhatsApp group, no problem. Thank you all. This one I'm ending the session. The tomorrow session will start at 11 as per the schedule itself.